Welcome to the Rare Wellness Podcast. Pressures of this modern life, society, and world often steer us to unhealthy lifestyles, but wellness is a rare treasure hidden in the maze of daily challenges. In this podcast, we'll illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today we're going to dive into creatine, why this gym supplement is actually a powerful tool for the muscle, brain health, and healthy aging. This podcast is brought to you by Center for Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.c4rpm.com. Before we begin, a quick disclaimer. This podcast is for educational purposes only and is not intended for medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. All right, what is creatine really? Creatine isn't just a bodybuilding supplement. It's a naturally occurring compound your body makes from amino acids, and it stores mainly in muscle and brain tissue. Its job is simple but critical. It helps rapidly regenerate ATP, the energy currency your cells use for short, intense efforts like sprinting, heavy lifting, or even intense mental work. We get some creatine from foods like red meat and fish, but many people, especially vegetarians or vegans and older adults, have lower baseline stores. That's where supplementation can make a meaningful difference, not just for athletes, but anyone interested in performance and longevity. Creatine for muscle strength and healthy aging. Most people first hear about creatine in the context of strength training, and the reputation is well earned. Multiple randomized trials and meta-analysis show that creatine plus resistance training increases lean muscle mass and strength more than training alone in adults under 50. The story gets even more interesting in older adults. As well as we age, we naturally use muscle, a process called sarcopenia. That loss of strength and power is strongly linked to falls and frailty and loss of independence. Meta-analysis in older adults show that when you combine creatine with resistance training, you can meaningfully improve muscle strength, function, and performance, like chair stands or walking tests, and sometimes lean muscle mass compared with training without creatine. From a regenerative and longevity perspective, that's a big deal. We talk a lot on the show about muscle and medicine. Creatine isn't a substance or a substitute for lifting weights, but it can be a simple, reliable, low-cost tool to help you get more out of your workouts. You're already going to the gym or already doing physical therapy, then creatine can help you get to the next level. Let's talk about creatine for brain and cognitive resilience. One of the points emphasized in a recent conversation between Dr. Pete Attia and Dr. Rhonda Patrick is that creatine's brain benefits are often overlooked compared to its muscle benefits. Your brain is an energy hog. It uses a disproportionate amount of your daily ATP. Several lines of research now suggest that boosting creatine stores may support cognitive performance, especially under stressful conditions. A large randomized double-blind placebo-controlled trial using 5 grams of creatine per day found small but measurable improvements in certain cognitive tests, particularly in individuals with lower baseline creatine stores, such as vegetarians. A newer crossover trial looked at people under partial sleep deprivation and found that a single high dose of creatine helped preserve cognitive performance and brain energy markers during prolonged wakefulness. These effects aren't magic or massive, but even modest support for attention and processing speed and mental resilience under stress may matter over decades, especially when you stack creatine with good sleep, nutrition, and exercise. Is creatine safe, and what about the kidneys? Creatine has probably generated more myths than almost any other supplement, especially around kidney damage. This is largely from the fact that creatine can slightly increase blood creatinine, which is a lab marker we use to estimate kidney function. That rise reflects creatine metabolism, not necessarily kidney injury. When you look at the actual data, several systematic reviews and controlled trials, some following people long-term, have found no evidence of kidney function decline in healthy adults taking creatine at standard doses. That said, there are important caveats. If you already have kidney disease, are on nephrotoxic medications, or pregnant or breastfeeding, or have some complex medical conditions, you should absolutely talk with your healthcare provider before starting creatine. Some people do experience side effects at higher doses, things like bloating, loose stools, or temporary water retention. These are more common during the loading phase with large doses and often improve when you scale back to a standard dose. Bottom line, in healthy individuals, creatine is one of the most studied and generally safe supplements we have when used appropriately. But like everything we discuss on this podcast, it's not a one-size-fits-all, and it's not a replacement for medical care. Practical dosing, how to use creatine wisely? Well, for most adults, an evidence-based and simple approach works best. Standard daily dosing of 5 grams once daily is appropriate for the majority of people. This is enough to saturate muscle stores over time without needing a loading phase. For higher demand situations, consider 10 grams per day, split into 2 doses. Some individuals place higher energetic demands on their muscle and brain and may benefit from this higher dose divided. This includes people who are engaging in vigorous strength training or individuals in a metabolic optimization program aiming at reducing fat while maintaining or gaining muscle. Anyone who is sleep deprived or has sleep loss depletes brain energy stores, and creatine can offer some cognitive support under these stressful situations. Vegetarians and vegans typically have lower baseline creatine stores due to limited dietary sources. They may also consider doing the 10 gram per day dose divided twice daily, especially during the initial months of supplementation. In addition to sleep deprivation and metabolic stress, the body experiences significant physiological stress following any kind of injury or surgery, often leading to rapid muscle loss. A number of randomized trials in orthopedic populations have shown that amino acid formulations, particularly amino acids with branched chain amino acids, can help blunt this postoperative atrophy. Based on this evidence, we now routinely prescribe recovery formulation that includes both creatine and amino acids in our patients. Additional notes: creatine monohydrate remains the safest, best studied, most effective option. Hydration is important. Maintaining good hydration is advisable as creatine increases intracellular water. And consistency and timing is important. Taking creatine with a meal is fine. The key is daily consistency. Individuals with kidney disease or on a nephrotoxic medication should consult with a clinician before use. How creatine fits into regenerative medicine, performance medicine? Well, in the context of regenerative medicine, we think of creatine as a foundational performance molecule that supports high energy exercise and strength training. It's a tool against sarcopenia and frailty, especially when paired with good strength training programs and adequate protein intake. A promising adjuvant to brain health and cognitive resilience, particularly under stressors like aging, sleep loss, or neurologic disease, although we still need more data to know exactly how far these benefits go. It's not a magic bullet. If your sleep, nutrition, movement, and stress are a mess, creatine won't fix that. But if you're already doing the work or are ready to start, creatine can be a smart, evidence-supported force multiplier to help you hold your muscle and function as you age. Thank you for joining me today at the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, or share this podcast with a friend. Your support helps us to contribute free content to empower you on your journey to better health. Again, this is Dr. Jamie Lewis reminding you that your body holds incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential and help you live your best life now. We'll see you next time.